Welcome back to Time Warner Cable DMG TV2's Medical Minutes. I'm Jennifer Clark, and this time around we have Dr. Greg Boone. He is a surgeon with Mercy Medical Center, and we are talking about breast cancer. October is Breast Cancer Awareness Month, and there's so many women that have breast cancer or know someone. It touches so many lives. But what can you do about it? As a surgeon, every breast cancer patient needs some kind of surgery, right?
Yes, for the most part, surgery tends to be the primary treatment for most breast cancers. And you know, the really good news is that our success rate in curing breast cancer has just really blossomed in the last 10 to 20 years. Most women do need some form of surgery as an initial treatment to control the disease locally in the breast. That's one of the roles the surgeon plays. And perhaps as important a role is to gather information that helps the other team members that treat breast cancer to make good decisions and give good advice to patients about what other treatments above and beyond surgery that they might need. So the treatment of breast cancer is not one doctor, it's really a team approach. There are surgeons involved, the primary care physicians, who frequently are the initial folks who make the diagnosis or at least find the lumps or the abnormalities on mammogram that lead to the diagnosis. We have radiation oncologists that are frequently involved, our medical oncologists who use chemotherapies and other drugs, some that block hormone effects and things like that, to help treat the breast cancer. So it's a real team approach.
And there are different types of surgery. I mean, complete total mastectomy versus just removing a very small tumor.
Yeah, I think in general the two mainstays of the surgical treatment of breast cancer are mastectomy, or removal of the breast, which 25, 30 years ago was much more common than it is today, because a lot of women are diagnosed at earlier stage, meaning they have smaller tumors, and a lot of those women don't need to have the breast removed, so they can have a lesser operation and preserve the breast, which of course cosmetically is a huge advantage. The commonest term that gets used for that is lumpectomy, meaning that you would take the entire cancer out with some normal tissue surrounding the cancer.
And then some women have preventive surgery, and they think, you know, my mom had breast cancer, I don't want to do that to my kids, I'm going to have a mastectomy.
Well, yes, that's true. That happens sometimes, and of course that's been in the news a lot lately because of Angelina Jolie and finding out that she carried a gene that predisposes to breast cancer. Most breast cancers are not genetically caused, or at least we haven't identified a particular gene that causes them. It's only about 5% of breast cancers today that we can identify one of these genes, the BRCA1 and BRCA2 genes being the commonest, that we know are associated with a high risk of breast cancer. Clearly, if you carry one of those genes, doing prophylactic mastectomy, meaning removing the breast when there really isn't a cancer there, a healthy breast, can make a difference in your life expectancy. The truth is outside of that particular situation, removing the breast prophylactically, if there's not one of these genes involved, probably doesn't change your life expectancy. It does decrease your risk for developing breast cancer. So there are some women who are diagnosed with a breast cancer on one side who opt to have bilateral mastectomies to prevent that problem on the other side, and it does prevent the disease pretty effectively. But we probably don't change that person's life expectancy by doing that.
And in your practice, is it more of the lumpectomies that most people go to? I mean, you said we catch them earlier these days, so it seems that that's more common then.
Yeah, I think it has probably become more common, and that's because, of course, 25 or 30 years ago, it wasn't very common, so over time it's become more common. But I really, frankly, think it's a very individualized decision. And you know, one of my most important jobs has nothing to do with what I do in the operating room. It's what I do before the operating room, and that is give the patients the knowledge they need to make a good decision based on knowledge and not on fear. And so,
How do you control that? I mean, any woman who's facing breast cancer is filled with fear.
well, it's a very difficult thing, and any cancer is filled with fear, and I'm a cancer survivor, so I personally know what that fear is like. But knowledge is power, and if you can gain that knowledge, and it takes time, and it takes a team of people to give you the knowledge that you need to make those good decisions and to make them based on that knowledge and, again, not on fear. A lot of women come in and think they already know what they want to do because their gut reaction to having cancer is get rid of it, take my breast off. But once they learn more, sometimes they change their minds, and sometimes they don't. And the truth is for women who have smaller tumors, whether they choose to have mastectomy or whether they choose to have a lumpectomy, which is most frequently combined with radiation treatment to the remaining breast, no matter which they choose, it's a good decision because under the appropriate circumstances, they're equal in regards to long-term survival. So once patients learn that, then they can make a decision again based on knowledge, not on fear.
And you mentioned earlier that it is a team approach, that the whole medical team works together. So even as a surgeon, you can kind of weigh in on who's a candidate for chemotherapy and radiation.
Well, certainly I weigh in on that sometimes because my patients will frequently ask my opinion about things. What I do, I think more importantly, is I gather information from what I do at the time of surgery that helps to guide the advice that the oncologists would give regarding chemotherapies or hormonal therapies and or radiation therapy. So learning about things like the exact size of the tumor, learning things that they do special testing on the tumor to look for things called receptors, where we can learn whether hormones like estrogen or progesterone might impact the growth of the tumor, and manipulating those by giving pills like tamoxifen or some of the newer versions of these drugs that block the estrogen effects, whether those will be beneficial. We learn that from taking that tumor out and doing testing on it, which of course our pathologists, another member of the team, very important member of the team, help us by studying the tumor and giving us that knowledge that helps to guide our treatment recommendations. We find out about the lymph glands underneath the arm, whether there's tumor involved with the lymph glands, and that helps to guide some of the treatment recommendations.
Now you seem so passionate about treating breast cancer. You are a member of the Susan G. Komen of Northeast Ohio. You're on their board of directors.
Yeah, that's right. I guess I'm passionate about cancer care in general, but for my...
That's the Live Strong shirt you're wearing right now.
That's correct. I'm also involved with the Live Strong Foundation. I think my real true connection to cancer came from my patients. I've been doing this for 24 years now, and always had a special interest in breast cancer, so I've taken care of a whole lot of ladies through the years with breast cancer, and some men as well, of course. And so that's where my real passion in battling cancer, I suppose, came from. And then 13 years ago, I was diagnosed with prostate cancer, and so my own personal experience certainly had an impact as well. So being involved nationally with an organization like the Live Strong Foundation, there's an organization that provides one-on-one cancer support based in Chicago called Emmerman Angels that I'm involved with as a medical advisory board member. And then here more recently being involved pretty heavily with the Susan G. Komen Foundation of Northeast Ohio as a member of their board. It's all important things to do and to try to make an impact.
Well, it sounds like you are, and you've already given us some good information about the surgical options that women with breast cancer will have. Dr. Greg Boone, he's a surgeon with the Mercy Medical Center. Thanks for being on Medical Minutes here on Time Warner Cable DMG TV2.